Hey everyone, this is Imran from Secure Your Benefits, and today I want you to pay close attention, because what's happening right now with Medicare isn't just another policy change, it's a warning sign. The so-called Medicare meltdown that's making headlines is just the beginning of something much bigger that could affect millions of retirees across the UK who depend on government-backed benefits to stay healthy, covered, and financially secure. What's happening behind the scenes could shape how the entire benefits system works in the years ahead. And if you're not paying attention now, you might end up paying the price later. Here's the truth: the NHS is under pressure. But so is the UK's entire system of senior support, including pension credits, disability benefits, and healthcare subsidies. Rising costs, an aging population, and funding gaps are creating a situation that feels eerily similar to what Americans are calling the Medicare meltdown in the US. Experts are warning that Medicare's hospital insurance fund could start running out of money in just a few years if changes aren't made. And while this might sound like an American issue, it's actually a global warning. The UK system could face a similar squeeze, and that means cuts, delays, and stricter eligibility checks for those who need help the most. Right now, across the UK, local councils are struggling to meet care demands. Hospitals are stretched thin, and benefits offices are getting more claims than ever. The government has already hinted at modernizing the benefits system, which sounds positive, but usually that's code for tightening budgets and reducing what people receive. When you connect the dots, the Medicare crisis in the US isn't just about healthcare. It's about how entire nations are rethinking what social support should look like in the future. Let's be real, both the US and UK have relied on systems built decades ago, when the population was younger and living costs were lower. Now, more people are living longer, healthcare expenses have skyrocketed, and fewer workers are paying into the system. That creates a perfect storm. And just like in the US, where people fear Social Security might face shortfalls next, in the UK many experts are quietly warning that pensions and certain benefit payments could eventually face the same kind of funding strain. The Medicare meltdown is really a wake-up call, a reminder that no system is untouchable. If you're someone who depends on benefits, whether that's pension credit, personal independence payment, or healthcare support, it's time to start paying attention to what's being proposed in Parliament. Policy changes that sound small, like reassessing eligibility or streamlining benefit delivery, can have huge consequences down the line. Just look at what happened in America. Once small funding changes started, it opened the door to major reforms that affected millions of retirees and disabled citizens. Here's the part nobody's talking about. While politicians debate budgets and reforms, it's ordinary people who feel the impact first. Longer processing times, more paperwork, confusing letters about eligibility, delayed payments. Sound familiar? These are early signs that a system is under stress. And when the media talks about a meltdown, it's not about the system collapsing overnight, it's about the slow erosion of reliability. The moment people start losing confidence in the benefits system, panic spreads fast, and misinformation starts filling the gaps. That's why staying informed is your best protection. In the US, there's growing fear that once Medicare starts cutting costs, Social Security could be next in line. In the UK, if healthcare budgets keep tightening, that pressure could spread to other support programs, especially those designed for low-income and retired citizens. Once cost-cutting becomes the focus, it rarely stops with one department. That's why many financial analysts are calling this the beginning of a global benefits reset. But here's the good news: being prepared means you're already ahead. The people who stay updated, who understand the signs, and who know how to protect their entitlements are the ones who won't be caught off guard. Whether it's keeping your benefit documents up to date, checking official announcements, or staying connected to trusted sources like this channel, these small steps make a massive difference. Knowledge really is your best defense when the system starts shifting beneath you. If this all sounds worrying, remember this: every time a major system goes through change, there are opportunities too. Governments eventually respond to public pressure. When enough people speak up, they slow down reforms that hurt the most vulnerable. That's why it's so important for everyone, especially retirees, carers, and disabled citizens, to stay informed, raise awareness, and make their voices heard. It's not about politics. It's about protection. The benefits you rely on today were built by decades of people demanding fairness. That same collective awareness is what keeps the system alive. So, when you hear Medicare Meltdown, don't just think about the healthcare crisis. Think about what it signals for the future of benefits everywhere, including right here in the UK. Think of it as a warning that systems built on yesterday's assumptions need today's attention. We can't stop demographic change or economic shifts, but we can make sure the people who depend on these programs aren't the ones left behind when funding cuts or policy changes roll in. Before you go, if you found this video helpful, please take a second to like it and share it with someone who depends on UK benefits. It really helps more people stay informed. And if you're new here, make sure to subscribe to secure your benefits and turn on notifications, because I'll be breaking down every major update about pensions, healthcare, and benefit reforms as they happen. Together, we can stay one step ahead, protect what we've earned, and make sure no one gets left in the dark.
Hello everyone, this video is created for educational and informational purposes only. It is based on verified public reports and expert opinions about US Medicare and Social Security updates. This content does not provide financial or legal advice. Always check official government websites for the latest updates. All visuals used are royalty free and created for illustration only. I am Imran from Secure Your Benefits. See you in the next update. Take care.